Hey everyone, I got 2 more video requests from Hot Chocolate Sunday, and she was asking me to talk about EDs and anxiety and EDs and depression. It is really common for individuals suffering from eating disorders to have comorbid psychiatric conditions like anxiety and depression. Those are probably 2 of the most common. Also, OCD is another big one. Sometimes these are generated as symptoms of the eating disorder, especially in more long-standing cases and more severe cases, like when you're underweight. Interestingly, in studies of other individuals who have been made malnourished and underweight from independent causes, not from eating disorders, a lot of these symptoms developed as well. They did a lot of studies of like POWs from the war, from different wars, and how they began developing obsessive compulsive and eating disorder thoughts as well. So it's not intrinsic to the eating disorder solely. It can be brought on by other conditions. And then there are actual independent conditions that even if the eating disorder is treated, they persist. So yeah, they're definitely related. Anxiety, depression, and obsessive compulsive disorder, I think, are the 3 most common conditions that coexist with anorexia and other eating disorders. I'm not sure exactly what you wanted me to discuss, or if you wanted statistics or treatment information or coping skills. Let me know more about what you were looking for. Anxiety disorder there's good coping techniques for that I can go through, and also medications that can help, and same with depression. In things like depression, often medications are one of the most effective therapies because typically this is caused by an imbalance in brain chemistry, and probably the reason it is so common in anorexia is because in a fasting or a malnourished state we have inadequate levels of serotonin, so it's very common to coexist with anorexia. And also in like bulimia nervosa, a lot of the impetus to purge is to get that flooding of dopamine that comes after you purge. So binging and purging can become a compulsion to feel better about things rather than just motivated by, I wanna, we hear commonly like binges are to fill a void inside, or allow yourself to indulge if you feel ashamed about your size, and then purge to remove the guilt that comes after. But in a lot of cases, as the disease progresses, it will become a situation of chasing that dopamine high that comes after you purge. And again, it's an aberrant coping mechanism to try and address a neurochemical response, which can be effectively addressed by medication. And as I mentioned in the other video, bulimia nervosa is one of the most responsive eating disorders when it comes to treatment, and fluoxetine Prozac is a great treatment. I mentioned this before. 60 to 80 milligram doses are effective in helping reduce the compulsion. So yeah, there's a lot of neurochemical factors that can be associated with our eating disorders, and medications are very significantly helpful. Anxiety can come for a lot of reasons. In the more established eating disorder state, unfortunately, the more immersed and entrenched we become, the more severe our anxiety, not only about weight and appearance insecurity, but because we begin to use the eating disorder as a way to cope, to suppress, to alter our emotional state, to avoid addressing the problems directly or dealing with them, then it can become a very cyclic, worsening condition with the anxiety, not only due to eating disorder symptoms on their own, but also because we are avoiding dealing with the real issues that are precipitating discomfort. So this is a whole big, huge topic, and there's a ton of different things to talk about. So Give me more information what you'd like to hear more about, and I'd be happy to discuss these further. Much love, sweetheart. Be well, precious ones. Bye.